We are very fortunate to live in a time where the malaria incidence in the country is going down. It is getting better, especially in the last 5 years, where we have had almost like a 90% reduction in cases. But I think we are very well now poised to go in for elimination. And that would mean that every single case that exists anywhere needs to be taken care of. The Honorable Prime Minister has given us this vision of eliminating malaria by 2030, which means that by 2027 we should go down to 0 cases and stay that way for 3 years before we get the WHO certification that will declare India malaria-free. We are poised to do that, but we need to do a lot of things very differently in order to achieve it. The biggest challenge facing malaria in the country today is that in terms of resources being allocated to the programs, we feel that it is grossly inadequate. So far, even the budgets that are internally allocated or assigned for within the Ministry of Health as per the strategic plans do not get really fulfilled. That is one. The second big challenge in malaria is that the private sector, both formal and informal, have not been included in the battle against malaria. So far, most cases are actually coming in only from the public sector. And in a country where almost 70% of the people go to the private sector, to leave out in cases that come into the private sector is hugely damaging. So to a good extent, I will not be surprised that we are missing out on a large chunk of the population that needs attention as far as malaria is concerned. And this becomes even more important when we are looking at elimination, where every single case is important. Thirdly, we are not looking at asymptomatic cases. So cases where a malaria patient may not be manifesting fever. Because the patient is not showing fever symptoms, they do not go for malaria testing, in which case the parasite continues to reside in the body of such patients and they act as reservoirs for further transmission as and when a mosquito bites them and bites other people. Other challenges are mainly around lack of coordination between different government departments. Health is a state subject, but the battle against malaria needs many more people to come in. Vector control measures are something that we have to look at very deeply. There is a lot of abundance of mosquitoes that are still around. Municipalities have to do fogging. Panchayats have to ensure water logging does not happen and mosquito breeding grounds are taken care of. Finally, our ASHA workers have to be motivated to look at malaria more seriously because they are our front line. They are the ones in the battlefield and at the last mile. If they are not incentivized well enough and they do not feel motivated to look at malaria, it will be difficult for us to conquer the disease. And the same applies to drugs and diagnostics and kits that will be necessarily at the last mile, because if you do not test enough, you are not likely to find enough cases and hence there will be no treatment and the journey to elimination will be just as tough. One of the important challenges we foresee is lack of reporting. Now this happens for several reasons. One, of course, there is not enough incentive for doing testing, so there is not likelihood of too many cases to come through. Second being that as the country is showing a trend of declining malaria cases, it's very odd for most officials to raise their hands and point out that that their district or their block actually showed more cases, because that is not something that is looked kindly upon. So we are in a phase where people are reporting less and less. And as we go closer to elimination, that is also going to be a trend going forward. And thankfully so, we really hope that the malaria cases are coming down. But when it comes to elimination, we should be very clear that every single case has to be reported, and they have to be reported very quickly. Because if we allow a reporting cycle of a month, which is the current case, then the whole malarial cycle would have come and gone. The way forward would be to, one, be very diligent about ensuring private sector join hands with the whole fight. Not just the formal sector, the informal sector. most malaria cases happen with the poorest of the poor, the tribals and villagers and others who may not have access to formal private sector settings, and they do go to informal providers. It is important that they also come in the ambit. It is important that all of them report so that no case is lost in terms of the government's database, capturing any incidents, any outbreaks anywhere. It is important that diagnostic toolkits and drugs are made available, supply chains are strengthened, so that no ASHA worker or no place that needs a testing to be done will not be able to do so because kits are not available. It is very important that urban town planning, Panchayati Raj institutions and all of them combine hands to ensure that water logging, sanitation and things like that are managed at a level where mosquito breeding is taken care of in a manner that the whole problem can be addressed. And finally, I believe that there is a very large scope for public-private partnerships here. We are looking at interdepartmental approaches. We should be looking at public sector corporations, corporate corporations coming through. We are looking at defense, paramilitary, railways and other forces joining hands, and all of them need to come together if we have to realize the Honorable Prime Minister's dream of a malaria-mukt Bharat.